Probably one of the really most common is dogs that present and the veterinarian assesses that they are vomiting, and they're vomiting because they've eaten something wrong. You know, they've gotten to the garbage, they've eaten something disgusting in the park, they've got what we would call a dietary indiscretion. And they are very frequently treated with antibiotics, and that's completely inappropriate. Those animals, A, don't have a bacterial disease, B, they've got gut disease, irritated gut, and we're giving them antibiotics which is potentially going to change that gut as well. So that's one of them. Another one would be young cats that present with signs of lower urinary tract disease, so they present with signs of cystitis. Now, if that was a person, one of us, presented with hematuria and dysuria and plaquuria, chances are we've got a urinary tract infection. See a dog, particularly a female dog, present with dysuria, hematuria, plaquuria, chances are it's got a urinary tract infection. It can have other things, but in the cat, their urine is quite resistant to bacterial growth. And so if they're younger than 10, then probably the chances that they've got a bacterial infection would be about 1%. They're much more likely to have anxiety-related, lower urinary tract disease, possibly stones. Once they get a bit older and potentially their urine becomes more dilute as perhaps their kidney function starts not to be quite so great, then they can get urinary tract infections just like dogs and cats do. So that would be sort of the two probably where antibiotics are used commonly, because in both those situations, those animals get better regardless. So the dog that's vomiting because it ate something disgusting is going to get better. So we also know that most antibiotics don't really have many side effects, and so the vet will go, well, what does it really matter? But it does matter because we're giving antibiotics to an animal that doesn't need it. We're therefore increasing the risk that we're going to create some resistant bacteria in their normal flora, and the harm, if you like, doesn't outweigh the good. There's a few other ones. Very commonly, animals that have periodontal disease, dental disease, will be given antibiotics routinely before, during and after the dental. Most of those animals don't need antibiotics. The treatment is treating the teeth, extracting the teeth. Most of them don't need it. The other one that is relatively common is giving prophylactic antimicrobials in surgeries where they don't need it. So in routine surgery where aseptic technique hasn't been broken, where it's not a prolonged surgery, healthy animal, there's no risk factors, those animals don't need prophylactic antimicrobials. So our routine neuters do not need prophylactic antimicrobials.